Okay, I'm just getting tired.
okay?
Easily. Yeah, I've been running for only a second. I'm already
Yeah.
getting tired. I've been having this like fatigue lately. It's really ridiculous.
Really?
Yeah, and then
Since
I
when?
noticed since for a month now. I noticed that I can't even concentrate in school.
Mm-hmm.
I can't focus. And I always zone out. I can't concentrate when I'm studying.
Mm-hmm.
It's weird. I don't know what's going on.
You know what? It happened to me too. And then I noticed I've been diagnosed with hypothyroidism lately, and that's what I noticed with myself exactly. I had
Really?
yeah, I had very dry skin. Have you noticed that too?
Yeah, I noticed that. I
It's very
always
flaky,
get that.
even
Yeah.
if you put a lot of lotion.
Oh, I put like a gallon of lotion. And I still like have flaky skin.
Yeah, that's my problem too. And I'm gonna tell you a secret. I had constipation a lot of times. Did you notice it too?
It's yeah, not a lot, but like I've been noticing constipation. I thought it's just my diet. I thought it was just like I've been eating something that's making me constipated.
And what I noticed as well with my hypothyroidism is that I noticed that I gained weight without apparent reason. I still eat the same kinds of food, the same
Yeah.
amount of food, but
Yeah.
yeah, I gained weight.
Well, I have been gaining weight, and then I noticed that it's harder for me to lose weight.
Yeah.
So I'm okay.
You know what? What I suggest is
Yeah.
you go see your doctor and see whatever, like you can have it. Maybe she or he will get you to a test for your
Okay,
blood
I
and
see.
see if it's hypothyroidism or not. So
Okay. All
it
right.
might be better if you just go and see your doctor.
Okay, thank you. I'll go and see and check what it
So
is.
are you ready to go?
Okay, let's go.
Okay.
Let's try.
Hi Tisha, I'm Kamsit. I'm a lab nurse. So I'm going to take your blood for a blood test for the hypothyroidism. Let me look if you have the hypothyroidism.
Sure.
How's it doing today?
Is it gonna hurt?
No, it's not.
I'm good. Just a bit scared. I'm not really. I don't like
Okay.
getting poked.
I took your blood, so the other nurse will help you with what's going on. Okay, thank you.
Oh, hi. Hi, is Trish there, please?
Yeah.
Oh, hi, Trish. This is Sarah, your nurse practitioner. How are you doing today?
Oh, good. How are you?
I'm good, thank you. Okay, so we got your results in. So maybe you could come in about 5 hours, and we can just sit down and talk about everything.
Oh, yeah, that's perfect.
Okay, we'll see you soon. Okay?
See you soon. Bye.
Bye. I know. I can't wait
Hi
till
there.
summer. Oh, hi, Trisha. How you doing?
How are
Hi,
you?
Tisha.
Have a seat.
Thank you. I'm a bit nervous
Oh,
about
don't
the
worry.
result.
Oh, no, don't worry. This is, hypothyroidism is very common, so, you really don't need to worry. We're just gonna talk about your lab results here, okay?
Okay, so you know the normal TSH level is 0.3 to 155, and your TSH level is 22, which one is 4 times higher than the normal level. But don't worry. Yeah, and this the radioluminescence showed the T serum level of T3 and T4. Serum TSH level decreased with thyroid insufficiency, which you have it. Serum cholesterol, alkaline phosphates, and triglycerides levels are elevated. The one thing is arterial blood gas result showed decreased pH and increased partial pressure of carbon dioxide in myxedema coma, which you don't have it, so you don't have to worry about the myxedema coma.
Sorry, what exactly is TSH?
It came from anterior pituitary gland from the brain.
Okay, I see.
Sometimes drug causes hypothyroidism, is like the iodides and the lithium.
And what are the other causes of?
The first cause is autoimmune thyroidism, and
Thyroiditis is a bit of a tongue twister.
thyroiditis. Yeah, I have a question. Do you have ever had the thyroid gland surgery?
Surgery? No.
Yeah, because that's the one causes too for the hypothyroidism.
Oh, no, I've never had it.
So, as I said, hypothyroidism is very common, so I'm just going to talk to you about the treatment. So, the number one treatment is levothyroxine. It's a T4 hormone replacement therapy. and basically you take it on an empty stomach every morning,
Okay.
and
Drink of water.
yeah, with some water, exactly. So the problem, not a problem, but the thing about hypothyroidism is it is a lifelong thing, and the treatment is lifelong
So that means I'm on my medication
for the rest of your life.
So-
Right. But it's as I said, it's very common. So I just wanted to say a couple of things. One of the things that we talked about before was the myxedema coma. Okay, so if you were to have, what this basically is, I'll just explain this. I have a pamphlet here on hypothyroidism that I'm going to give to you. So it's just good to have something at home so you can look at things. So the myxedema coma, it's very rare, and basically this is what happens if you have untreated or poorly treated hypothyroidism. Okay, so it's basically your heart can stop, and basically like it has a very high mortality rate, and it's very life-threatening emergency. Okay, so everything with hypothyroidism, it controls your whole metabolic rate of your body. So if it were to go so low,
Okay.
you would have multi-organ failure, multi-system organ failure. So basically, if that were to happen, you would come into the hospital and we'd maintain your patent airways. You'd replace your fluids with IV, give corticosteroids as prescribed, check the patient's temperatures, and you'd cover with a warm blanket, monitor for mental changes and statuses, and give levothyroxine sodium as prescribed. And we'd also use aspirate precautions. Now, this is something that you don't really need to know. I just like to tell patients up front about why it's so important that you do take this medication, because things like this can happen. And I like to tell patients also what, if that did happen, how you would treat it.
Now, when I'm taking the medication, what are the side effects? Because I personally don't like taking medication, but since you brought that up, then I mean,
Yeah, I know, and it is something, there's actually a lot of women in my family that actually have hypothyroidism, and I know, you know, how you feel about not wanting to take medication, you know, every day, because, you know, it can be a bit of a nuisance. So the side effects, there aren't really a lot of side effects for this medication. However, if you were to take too much of it, so it's one of those things that we're going to test your blood, you know, every 6 weeks to see where your level is at, to get it at the right level. Now, if you were to take too much of it, you're going to have feelings like excitability, irritability, and anxiety.
is that normal?
No, that would be an overdose. That would be too much of that drug in your body. Another thing that's kind of a fact that I like patients to know is that as you age, the levothyroxine thyroid hormone therapy, it affects your heart in a different way. So as you age, we're gonna, you know, we decrease it a bit. So it's just something I like patients to know, to understand that can happen. So now what we're gonna just talk to you about is just a bit of like a patient teaching, which I have on the back of here, just some important notes.
So you should take your medicine, or just take an empty stomach without food, and take a fibers in your diet, and drink plenty of water.
Okay.
That is good.
Yeah, so as she said, with fiber and drinking lots of water, as you said before, one of the things you're experiencing right now is constipation, right?
Yeah.
So as we level out your TSH level, you know, hopefully the constipation will go away. But I always tell everybody, drink plenty of water and have lots of fiber in your diet, because, you know, naturally in our North American diet, we don't have enough of those things and we need more of them. So as I said before, the levothyroxine hormone therapy, it's not a cure, but it will help treat, and it will help minimize all the symptoms that you're experiencing right now. As I said before, it is a lifelong therapy, and it can take up to 6 weeks for it to actually take effect. And that's why, as I said before, we're going to take your blood every 6 weeks to see your level, and if we need to increase or decrease.
Okay.
Okay. Now, another thing I would like to tell patients is something called a thyroid storm. And it's also written, I wrote in the pamphlet, you know, this is, it's a great pamphlet, and I wrote a little bit about that in there. We worked on that together, and the thyroid storm, basically what happens is when you take your thyroid T4 replacement therapy, the levothyroxine,
Okay.
and say what happens is you take way too much of it. Like you know, and it's really hard to do this, and it's very unusual for this to happen, but some people's bodies digest things in different ways. So say you took too much, or one day you forgot you took the pill 6 times, and that happened for 3 weeks, so you're taking way too much of it. What can happen is actually you can kind of go from hypothyroidism to hyperthyroidism.
Oh, really?
Yes. And what happens is, like with hyperthyroidism, you lose a lot of weight. It's kind of basically the complete opposite of hypo. Exactly. So what can happen is that one major sign of this thyroid storm is your body's temperature. So if you were to have way too much of T4 in your body, you're going to get a fever of 105 to 106 degrees. So if you ever experience anything like that, it can be very life-threatening and it's very serious. You need to call me right away or go to the emergency right away and explain the medications you're on. Other things that you need to know is to avoid iron, antacids, and calcium 2 hours after your medication is administered. So when you take it in the morning, say you take it at 6 a.m., by 8 a.m. you can have, your bagel with cream cheese or bacon and eggs or whatever,
No, I do take iron supplements, but can I still take that like way after? Or
Yes,
yeah.
absolutely.
Okay.
So, if you take it at 6 a.m. or even, we'll say 6 a.m., by 8 a.m. you can take your vitamins, your supplements and everything. And I actually suggest to all patients to do that, to wait. That's the best thing to do, just to avoid any interactions. So as I said before, I'm just going to give you this. We have a little bit about like hypothyroidism, the causes, as we talked about. Signs and symptoms, assessment, diagnostic test. As you know, you had a blood test, and the treatment plan that we're going to be going on. And just a little bit on the back is just some patient teaching, just so anything that I've said today, if you're a little, I can't remember what it was, it's on here.
Okay, thank you.
So yeah, okay. So we're going to I'm going to write a prescription for you right now. And we're going to put you on the medication, and then we're going to be checking your blood in 6 weeks. And do you have any questions?
No, so far so that's it.
Okay, there you go.
Thank you.
You're welcome.
Have a great day. Thank you.
What up, everyone? My name's Sarah. I'm your nurse practitioner.
I'm Lorraine, the friend of Trish.
Hi, I'm Karmjit, lab nurse.
And I'm Trisha, the person who has hypothyroidism.